So, Morocco is doing something huge right now. It's in the middle of this really ambitious plan to completely overhaul its healthcare system, aiming for universal coverage for everyone. But, and this is a big but, there's a crisis happening at the exact same time that could bring the whole thing crashing down. And this paradox, this tension, it all starts with one specific, powerful issue. Right at the heart of this problem is something they call white migration, or al-hijra al-bayda in Arabic. Now, this isn't just a handful of doctors deciding to leave. We're talking about a mass exodus, a brain drain of the country's most essential medical talent. So, to really get a handle on Morocco's healthcare challenge, you first have to understand why so many of its doctors are leaving. Every single year, the estimate is that somewhere around 700 doctors pack up and leave Morocco for good. Just let that number sink in for a second. That's like 2 doctors leaving the country every single day. And to really put that into perspective for you, that 700, that's almost a third of all new medical graduates in the entire country. Think about that. 30% of the brand new doctors, the next generation, are deciding to build their lives and careers somewhere else. I mean, that's not just a leak, it's a full-on hemorrhage of talent. Okay, so it's really easy to look at this and think, well, the migration is the problem. But what experts and the data on the ground are telling us is that this exodus, it's actually just the most obvious symptom of a much deeper illness, a healthcare system that's been under incredible strain for a long, long time. It's really a classic push-pull situation. The union head, Ali Lofty, puts it perfectly. Doctors aren't just being pushed out by tough conditions at home, they're also being actively pulled in by countries like France and Germany, who are dealing with their own doctor shortages and are basically rolling out the red carpet for this Moroccan talent. So, to figure out why so many doctors are heading for the exit, we kind of have to diagnose the system they're leaving behind. And when you really start to look closely, what you find is a system that's just full of these deep structural divides. The sheer scale of the staffing crisis is, well, it's staggering when you see the numbers. Morocco has just 7.3 doctors for every 10,000 people. That is way, way below the World Health Organization's recommendation of 23. It's barely half the global average. So the country is already starting from a really deep hole. But here's the thing. That shortage isn't spread out evenly. And this number it's genuinely shocking. A full 97% of all public hospitals in Morocco are located in cities. That creates this gigantic geographic split in who can actually get care. And this inequality, it has a real life or death consequences. A memo from the Mountain Coalition, which advocates for these rural areas, puts it bluntly. This lack of doctors and nurses isn't just an inconvenience. It's a direct threat that could lead to more deaths among the most vulnerable people, like pregnant women and their newborn babies. Let's just make this super concrete with an example. If you go to a rural province like Tawanate, the numbers are just grim. You've got only 1.3 doctors and 1.3 hospital beds for every 10,000 people living there. That's not a gap in care, that's a chasm. Now, faced with this really deep-seated crisis, the Moroccan government has not just been sitting on its hands. It has launched what you can only call a radical, super ambitious plan to treat the entire healthcare system. And this wasn't just some sudden reaction. It's part of a long-term strategy. It actually started way back in 2005 with a couple of different insurance programs. Then, in 2022, they took this huge step to merge them all into one single system for everybody. Now, the whole effort is getting supercharged with a $450 million loan from the World Bank and massive government spending. The health budget is set to jump by over 65% in just 4 years. So what does this big reform actually do? Well, first, it puts all Moroccans under one insurance umbrella. And crucially, this means everyone, even people who were on state aid before, can now go to both public and private clinics. And to try and stop that brain drain we talked about, they've boosted doctor salaries by about $380 a month and made family benefits better, like letting kids stay on their parents' coverage until they're 30. So this is where we get to the core tension of the whole story. On one side, you have this incredibly ambitious, well-funded plan for reform, but on the other side, you've got the harsh reality of the crisis on the ground. It's a real race against time. This slide pretty much lays out the paradox in a nutshell. The promise is amazing, right? Universal insurance, access to private care, tons of government money flowing in. But the reality is, there's a deficit of over 30,000 doctors, almost all the hospitals are in cities, and the country has less than half the doctors it should have by global standards. An analysis from the MIPA Institute really captured this contradiction during the pandemic. Morocco showed that in an emergency, it could move mountains, building field hospitals, making medical supplies at lightning speed. It was incredible. But that display of strength just can't hide the chronic, everyday weaknesses that are still there in the system.
At the end of the day, it all comes down to a really simple, fundamental question. You can give every single person an insurance card, but what good is that card if there's no doctor for them to actually see, especially if you live out in a rural province? Answering that question, that's going to be the real test of this whole thing.
So Morocco has written this bold new prescription for its healthcare system. It's backed by billions of dollars and a ton of political will. But the critical question that's left hanging is this: are these reforms actually treating the underlying disease, the systemic inequality and the resource shortages, or are they just treating the most visible symptom, which is the lack of an insurance card? The health of an entire nation really depends on the answer.